Good morning and welcome. My name is Patricia Batista and I am a program evaluation for NCTAC. And I'm very happy to be co-hosting today's webinar with my colleague, Boris Waglorin, who is the Healthcare Strategy Officer for CTAC and the McSilver Institute for Poverty Policy and Research. We welcome you to today's webinar titled Behavioral Health Information Technology for Home and Community-Based Services, or HCBS 101. Next slide, please. Okay. Our webinar will begin shortly, but before we start, I would like to go over some quick housekeeping items and then introduce our presenters for this webinar. If this is your first time joining us, we welcome you again. This webinar is being hosted by NCTAC and the New York City eHealth Collaborative. A little bit about NCTAC. NCTAC is the Managed Care Technical Assistance Center of New York. We are an organization serving and providing technical assistance for all behavioral health and substance abuse agencies during this transition to managed care. Another point of housekeeping is that please feel free to chat us if you have questions during the presentation. So we welcome you to do so. On the right-hand side, there is an open chat box. So during the presentation, as you have questions, please send those in. We will be collecting these questions, and we will hold time toward the end for a Q&A session. Another quick reminder is that slides and the recording of this webinar will be posted for your convenience on both websites, NYEHealth.org and our new website, ctacny.org. Recordings and slides are usually made available within a few days. And then finally, an important reminder is that slides and all the information presented are current as of today, Wednesday, September 14th. Next slide, please. It is now our pleasure to introduce our presenters for today. Our first presenter is Sharon Berry. Sharon is a Senior Implementation Manager. And our second presenter is Erica Manganelli. Erica is a Project Coordinator. And both of our presenters are joining us today from the New York eHealth Collaborative and provide healthcare advisory professional services. We will also be joined today by Tom Butaro and Eric Weiskopf. They both join us from the New York State Office of Mental Health and will be assisting us later during this Q&A session. That being said, we have now gone through our housekeeping items and our introductions. At this point, I'd like to turn it over to our presenters. So Sharon and Erica, the ball is now yours.
Thank you so much, Patricia, for that introduction. We welcome you. And we welcome everyone to this webinar today when we'll be discussing the BHIT program. It's an introduction to what that program is about for HCBS providers. We're going to be talking about eligibility for that program and participation, as well as the workflow for HCBS providers and what the electronic health records are about and how they will help you to bill to Medicaid managed care. Also, we will talk about the program structure, how funding is presented, how technical assistance is presented, the types of services that we have available for full, partial, and upgrade implementation of software. We're going to discuss the timeline of the program, and we're going to talk about the PIA, the Provider Information Assessment that you should have received in early August. So that's the agenda for today's presentation. Thank you again for joining us. So these are the concepts that I want you to walk away with from this presentation. I want you to understand about eligibility for state startup funding and what that's about. We'll talk about that in a little bit. We're going to talk again about that PIA submission, the Provider Information Assessment and Approval process. We're going to talk about managed care organization contracting and credentialing and how you need to be credentialing and contracting with an MCO to participate. We're going to discuss the OMH Readiness Survey, how you need to complete and submit that to be eligible. And what is a Provider Participation Agreement, the PPA, which is the official enrollment document which you sign and we sign to confirm your participation in this program, and how you need to have at least one HCBS service that's being provided, active, not on hiatus, in order to receive the funding. Once these first steps are put into place, then vendor services can begin, and we can assist you with our services to your organization. So this slide actually summarizes what this program is about. The program is really, the BHIT program is to assist provider organizations in the HCBS space to transition to Medicaid managed care. NYEC, as the subcontractors working with you, will help you, those providers in the rest of state, so that's in the 57 counties outside of the 5 counties in New York City, to adopt an electronic health record, or if you have a qualified system, to upgrade that system in order to meet the workflow for HCBS Medicaid managed care documentation and billing requirements. This program came about with the support of DOH, OMH, and OASIS, all organizations that help put the pieces together. DOH-MH from New York City is working with the 5 borough HCBS providers. The program started June 2016. It's a 2-year program, so it extends till the end of May 2018. Now you might ask, what is NYEC? We work for NYEC, the New York eHealth Collaborative. So we are working on a lot of programs within the state, that some of which you might have heard of. We are the SHINY, the State Health Information Network of New York, where we connect all patient data within New York State. We connect all the RIOs, the Regional Health Information Organizations, so that data on any patient is available at any part of the city and the state. We're also the ONC, the Office of the National Coordinator, which is the federal government, appointed us to be the Regional Extension Center, providing meaningful use services to over 5,000 providers in New York State. We now have active the EP2 program, so any eligible Medicaid provider that is interested in receiving payments for meaningful use, please contact us, because we have a program that's live, a grant with the state for that purpose, for Medicaid. We also are a PQRS registry, and we also are providing services for district PPSs for the district program, which is a Medicaid program as well, and we have practice transformation assistance, the PTN, for the Transforming Clinical Practices Initiative in New York State. We have been awarded that grant as well. So these are a lot of the programs that are all HIT related that we are working with. So these are the different organizations that join together to make decisions and collaborate on how this BHIT program should be. You're probably familiar with many of them. OASIS is here, ASAP is here, MC Tech, which we talked about. Thank you for hosting this program with us today. And as you can look around this screen, you'll be familiar with many others as well. And how does HCBS fit into Medicaid reform as we see it today? So as you know, HCBS providers are part of the medical neighborhood meaning all the contributors that work with patients throughout the state on their health. So they need to be connected to each other. So we're helping those HCBS providers to connect by enabling them to have an electronic health record system and billing system so that they can submit data and share data with the health homes as well as with the RIOs and all the different participants, so that the goal of improving care, improving engagement of patients, and lowering costs can be achieved with hospital admissions going down. So as part of this grant program, what are we doing? One part is that we are working with EHR vendors to make sure that they understand the HCBS requirements so that all vendors that are qualified can put in the same functionality so that HCBS providers can use those systems, because they were initially not set up that way. The other piece is this interoperability piece. As you know, we just spoke about how sharing of data is important and interoperability in order for information about patients can be shared amongst the different stakeholders. So we're going to educate you on this program about that interoperability. Who are the health homes in your vicinity? Who should you be speaking to? Which RIOs are in your area? Those are all important pieces of the puzzle. We're not going to actually make any changes to the systems to make them interoperable during this grant. We don't have funding here, but we hope in the future to have a grant like that, so interoperability can be better achieved. So what are these HCBS services? Many of you, of course, know that already because you are an HCBS provider, but those that don't. HCBS providers work with patients that have substance abuse disorders or severe mental illness, and the idea is to teach them how to become used to the daily living activities that they need to achieve, including services to help them live independently. And you can see some of the services below that in the left side top box. Below that, to return to school and find a job. And you can see the services below that that help with that achievement. On the upper right-hand side is manage crisis and stress. So that's to provide respite for those, as well as intervention. And on the bottom right is to give help from peers and other support. So those are the services. And the goal being that with improvement on this acclimatization to daily life, then they will be better, more well, and hopefully avoid issues in the future. Okay, so provider eligibility and participation. So this is how one determines whether they're eligible for becoming part of this program and participating. Okay, you need to have been an HCBS provider pre-designated by DOH. So DOH had asked you to apply for that designation, and we'll show you where that is on the website of the DOH website. And you need to have at least one active HCBS service. So some providers applied for those services, were granted services, but they put them on pause or hiatus. So they have to come out of that pause at least with one service to be eligible for these payments on this program and our services. Okay, also, we talked a little bit about the startup funding. So these provider organizations were also applying for this funding, and they're asking for it because they need assistance. They have never billed before using an EHR. They have never used an EHR before, so they need help to build an IT capable of hosting a system, so that if they were qualified for that startup funding, then they are qualified for this program as well. And the last one on this page is MCO. They need to have contracted with a managed care organization because that's where the billing takes place. Okay, so the claim is submitted to an MCO, and MCO has to respond that they received it, and then they are considered contracting with an MCO and sending through a claim, which is the goal of this program. If they're not actually contracted, they need to at least have an LOI, a letter of intent stating that they'll be working with an MCO. Okay, this is where we have the designation list. You will be receiving a copy of these slides, so you'll be able to see what the links are. And as you see on the bottom of this, this is a screenshot of the page. And on the bottom, it shows RESPA state designation, and it shows the list in Excel and PDF, as well as changes that take place. And this is what the actual page looks like when you open it. And it shows a list on the left side of all the agency names and the specific services that they have been designated for. Okay, so we're going to be giving two kinds of services. One of them is technical services, and the other one is financial assistance. And here is the list of the types of technical services that we are providing. So they would include an on-site assessment, which would be taking a look at your HIT needs and where you stand today. We'll assist for those that need full or partial implementation, meaning they don't have an EHR at all, or they have either a case management system or a billing system. That's called partial, one or the other. So we will give them assistance with selecting a vendor from a list of vendors that we determined were qualified, that have been upgraded for HCBS. Or for those that have a qualified system already, they will get the newest version that takes into account HCBS services. So those are some of the services, and then we will make sure that training and workflow has taken place within those systems. We're going to oversee the vendors work with you to make sure you understand how to use the systems, and then we're going to make sure that you can do a Medicaid managed care claim. You can send it to the MCO and receive a response in return. So you can see here on the bottom is a grid of those services that we'll provide. And then you, in order to get the funding, to get the dollars that you'll need to actually purchase or upgrade your system, you'll need to show us certain milestones have been achieved. So milestone 1 is that you've enrolled in the program, and it also incorporates a match with the right EHR for full and partial. So for those getting full and partial support, they will get the setup fees required to set up the system. For all of them, on milestone 2, you will get go live phase assistance, and there you'll get the licenses for using your EHR based on the number of people at your organization that are working with HCBS. And then milestone 3 is the third payment, and that will be for your year 2 user monthly fees for licenses, and that one you get when you prove that you can work with the MCO and that you can send a claim and receive a response. One important piece of this puzzle, which we mentioned a little bit earlier, is that you need to respond to the HCBS readiness survey. On September 1st, you should have received an email from DOH, and this DOH survey was to determine, are you ready to do HCBS services? You need to specify exactly which services you can do and you're ready to do, and which ones are on hiatus. And that's how we'll identify where you stand today. And that is critical. Without completing that survey, you will not be eligible for this program. So make sure to look for it, and if you don't see it, send us an email or reach out to DOH and make sure to complete that piece. Okay, now we're going to talk a little bit about the workflow. Okay, so how did we determine which vendors are qualified and which ones you can select from if you need a full system or a partial system? So we put out an RFI together with New York City, and we specified what we were looking for, what were the technical requirements for an EHR to satisfy what was needed for an integrated solution. We sent that out. We received 104 vendors were asked to participate, 22 responded, and 20 of them started off with the right qualifications, meaning it was an integrated solution with practice management, all of the information that was needed there, that it had case documentation, clinical care, and care coordination as part of what they had in place to begin with. And then what were we looking for as far as characteristics? It needed to be ONC certified. We needed to examine the interoperability and health information exchange capabilities. We needed to make sure it was flexible enough so that it could work with each agency. We needed to make sure also that it satisfied the technical specifications for HCBS, that it could incorporate that flexibly. And we were also more interested in a cloud-based or web-native solution because that would be easier to work with and easier to upgrade as needed. So the end result was that there were 2 lists. The first list meant that they satisfied the requirements going in, that they had these characteristics on this list. And then from that, we gave them the specifications of what was needed for HCBS, and then we reviewed to see whether they satisfied those requirements, and those would be moved to the qualified vendor list. This is the list that we will be looking at with you to determine which of the vendors can satisfy the requirements for HCBS. So as you see here, pre-qualified vendor list satisfied the requirements going in, but it didn't have the HCBS yet. Qualified vendor list, on the other hand, had everything plus HCBS based on our testing and demonstrations from the vendors. So this is the pre-qualified vendor list. These are the ones going in. We're going to ask you, though, not to select a vendor yet until we work with you to try to understand what would be the ones that we would suggest to you to best satisfy your requirements. So these are the vendors that actually were identified as present in New York City and satisfying the requirement. It could be that there will be some in the rest of the state that we will identify with you that will satisfy these requirements as well. So we could be adding to this list. So if the one that you are using right now is not on this list, don't worry about it. It could be that they'll be added. And how do we know about what you're using? So we mentioned a little bit about the PIA, the Provider Information Assessment that you should have received in early August. On that assessment, we're asking you, what is your EHR vendor? What are you using? What's the solution version? What are you using for billing if it's a different solution? If you have different solutions at different sites, we want to know about that as well. So from that, we're gathering information about your current technology and where you need to go. And we will understand also, is it a secure system that you have there? And what are your requirements going forward that we can help you with? And this is just an idea of the technology behind it and how the systems flow. On the left side is an existing EHR, and that's an EHR in all regards without HCBS. It needs to have company information, needs to have billing configuration, staff information, security, alerts. In the middle are the additions due to HCBS. So that would incorporate confidentiality as relates to behavioral health, which is a higher level than regular confidentiality, patient information, consents, and then HCBS consents as well. And then from that, an electronic chart is created, and on the right side is the HCBS services. Note that the ones that are in light peach or pink that have an asterisk are the billable services, and those are the ones we're going to send to the MCO. Now we're talking about the program structure. So there's 3 different types of support that we would be giving. Full support is for a provider organization that has no EHR and needs to purchase one. And it would have to be a certified one from our list. The middle one is for those that have either billing or case documentation, need one or the other. The upgrade are those that have a qualified EHR, it's on the list, they just need to upgrade to accommodate HCBS. Okay, so once you submit the PIA, and we know this about you, we understand where you stand, we will schedule a meet and greet. We're going to meet with you probably face-to-face most likely, so we'll get to see who you are, you'll get to understand who we are, and we're going to talk about what's going on at your site. What is your current HIT situation? What do you have in place? Who is going to be working on your system? What vendor do you have in place, and which vendors would make sense? We'll start working with on that. Those are the next steps. And then we're going to talk about EHR implementation, managed care billing. Those are all the pieces of the puzzle. We'll give you an introduction to all of that, and we'll put into place the next steps. So the HIT assessment, which I mentioned a little bit, and it's to establish what the requirements are for technology at your organization. Interoperability education we touched on earlier, and that is we want to understand, are you connecting with your health homes? Are you connecting with your RIOs at this time, which is your Regional Health Information Organizations, also called QEs or qualified entities? Because the more exchange of data, the better it is that we can understand how patients are doing, how members are doing, and what kinds of health care they've been exposed to and what they need going forward. So that we're going to educate you on that interoperability piece. Vendor selection comes later, and we'll offer you a menu of different vendors to select from. We'll try to match them for you the best, which ones make the most sense for you. And then comes the implementation. Go live will be proof that you've succeeded at implementation. And then the last piece is Medicaid managed care billing, that you have successfully billed to an MCO. So these are the actual physical requirements. You're going to have to provide proof, attestation, and submitting forms in order to make sure that you have reached the different steps in order for funding to take place. So this is a list of those. I'm not going to go into them. We've touched on all of them to date, in earlier slides. but you will get copies of these slides so you'll see them exactly, and we will give you a welcome packet that will actually inform you as to what the different milestones are and what you need to show us in order to receive funding. So some questions have come by, and people have asked, what is the preferred type of EHR vendor system? So we prefer cloud or SaaS integrated EMR billing systems. Why? Because they're easier to modify, easier to work with, any kinds of changes can be easily integrated, as opposed to a system at your site which would require a visit from the vendor. Next is how and when are payments made? Payments are made, there will be a standard cap dollar amount that will be calculated, has been calculated already for the city, and the state will calculate it once we see how many we have in each category, and they will be, these dollar amounts will be given to you based on those 3 milestones that we talked about, and depending on whether you're full, partial, or upgrade. What if I have, the next question is, what if I have funds remaining after I've already paid for my EHR and put all the pieces into place? That's a great question, and we have guidance that we put together to tell you what are the kinds of things that you can use that spending for, and you need to hold on to receipts to prove how you spent it. And the last one is, what's the timeline for actually contracting with a vendor for ROS adult HCBS provider agencies? So any contract that was written and signed by June 1st, 2016, which is when our program started and completed, or it has to be done between June 1st and December 31st of 2017 to be considered for payment under this ROS program. Okay, there are also, somebody asked, and this is an important question, there are some other grants that are out there. I think there's 3 of them. Some are for children, some are for adults, all in the behavioral health section. So how do they interrelate? And that's a really important question, because some grants pay for some things and other grants pay for others. I don't have time during this presentation to go into the details, but I'm going to direct you to this document in the middle of this slide saying spending guidance, and that one actually tells you specifically exactly what each grant is meant for and what you can spend it for, and the deadlines as well. Some of them are already finishing by the end of December, so make sure to take a look at this PDF. And if you have any questions, go to OASIS or OMH for those questions. Okay, now the timeline. So today we are actually completing that first task, which is the BHIT Intro Webinar. We had it on August 30th, and the recording of that one is already in place at the MCTAC website, and this is September 14th, so congratulations, done. And then the next few phases, you can see that what it follows and what our target is for being at those tasks. So you can get an idea of what we're hoping to achieve and when. So take a look at that. I didn't put in the assessment that came through from DOH, and that was already sent, and that has to be completed. So make sure to get that in and send that in. That was sent out by DOH, so make sure to complete that, because that's part of our program timeline. Next, I'm going to turn it over to my very capable assistant here, Erica Manganelli. Thank you, Erica. And she's going to talk about the PIA, the Provider Information Assessment, which is the document that you received and must complete and return to us by a deadline. Thank you, Erica.
Hi, thank you, Sharon. As many of you I've talked to already or have at least emailed with, I am Erica Manganelli, and I am pretty much in charge of the Provider Information Assessment. Any questions that you've had, I have answered them. Hopefully, they have been the answers that you were looking for. If you do have any more questions, or if you need help with your PIA, please contact me via the email address that is listed on this slide. Also, it's really important, next Wednesday, the 21st, is the deadline for the PIA. If for some reason you can't find it, haven't received it, please email me from the email address listed right here, or my phone information is at the end as well as the beginning of this presentation. It is recommended that the PIA be completed by the contact person that I will, myself or Sharon, will be working with throughout this program. but I do understand that everybody does have other work than a PIA, so if not, as long as they're CC'd, that would be great, so I know who I should be talking to. Throughout this program, the PIA will have to be updated, so if there's anything missing, for instance, I've actually had some people say we're applying for an MPI number, so it's not going to be ready, and that's okay. Just make sure you and I have a discussion about that, and during each milestone, it will have to be updated anyway, so I'm confident that you'll be able to update that properly. Also, it should be noted, as Sharon had stated, the New York State OMH Readiness Assessment was sent out on September 1st by OMH. If for some reason you can't find it or haven't received it, please email me and I will direct you to the proper site to complete this. This is a must in order to do this program, along with the assessment that I also had sent out. Moving on to our provider information assessment, you received it and it has 5 tabs, 1 being the instruction and 4 others. We have the provider organizations, which tells me what your organization's name is, provider sites, if there are any sites other than just 1, who your staff is, which is under staff details, or who your future staff would be, because I know at this time it is a little difficult if you have not started services yet to see how many staff you're going to have, as well as affiliated networks. At this time, it is only mandatory to have an MCO. You're only required for this program at this current time to have an MCO, but we do definitely encourage you to be connected with health homes, ACOs, RIOs. But make sure either you have it listed that you are contracted or you have an LOI with an MCO. Another important thing to note is that anything with a red asterisk needs to be filled out. I have had a couple questions where I have been asked, well, you asked for an MPI number and it has a red asterisk, however, our social workers don't have them. Well, if your social workers don't have NPIs, then please do not fill it out. You can just leave it blank. That is fine. As well, there are many drop-downs throughout this form, including the affiliated network information tab. Please make sure that you pay attention to that. As well, if you can't find, let's say, an MCO on the drop-down that you are using, just include in the email, just leave it blank and then write in the email that you're sending the form back to me, my MCO wasn't indicated in here, this is my MCO. And I will make sure when I upload this information that that is in there.
And I would just like to add that you should probably be contracting or credentialing with any MCOs that any of your patients, clients, members might use that insurance, that health insurance. So it's as many as you have you should include, but we only require 1 to participate.
The next we are going to be talking about provider organization and sites. So this is the next tab. This is, like I stated before, this information is going to give us the name of your organization as well as the sites that go along with it and who the contact people would be for those sites. As well, we also need to know if you are using an EHR, which is an EMR and a billing system, what they are. I've also had a lot of questions where people said, well, I have an EMR and I have a billing system, so do I need to do this program? And I definitely say yes, because your EMR and billing system do not have HCBS functionalities yet. So you are definitely encouraged to do this program because you would be considered an upgrade. Next, we have our provider staff and services. This is helpful because this is going to let us know how many licenses you are going to need for your organization. This also tells us the services that you're providing. There's 12 services, And the options for the status, which is really important for us to know, is providing services, designated, and prepared to provide services, hiatus, or dedesignated. As Sharon stated before, and I will reiterate this, you have to at least have one service that is not on hiatus, that is an active service, in order to participate in this program. If all of yours are on hiatus right now and you do not plan on having at least one of them become active, let's say, till the new year, please, you do not need to fill out the form at this current time, but you will need to fill out the form as soon as at least one service becomes active. That is really important to know. Lastly, we have our affiliated information tab, and once again, it is not required to have health homes, RIOs, DSRIP, or ACOs. It is required, though, to have your MCO. While the other four are not required, we highly recommend, this is only going to help Sharon and myself better assist you, as well during our interoperability assessment. This information is key. This is going to give us the best opportunity to show what is out there and available for you and have a better discussion. Next, I'm going to talk about the Provider Participation Agreement, which is the PPA. This is going to be given during our welcome packet when we have our assessments, our on-site assessments with provider organizations. This is an agreement between New York eHealth Collaborative and the organization, and it's outlining what the responsibilities are throughout this program. In order to start this program, this PPA needs to be fully executed by both parties. It is a pretty standard PPA, but we are always happy to go over it. Next steps, what is coming up? So some takeaways. So we want to ensure that it is a smooth implementation for rest of state. So we have some requirements. One of them, which I've also talked to many of you about, is have you received the startup funds? It's usually either $25,000 or $50,000 in state startup fund. If you are not sure if you have, please let me know and I can look that up for you. Also, you may have been eligible to receive those funds, but you never collected them, and that is okay. You are still eligible for this program. The next is, have you completed the Provider Information Assessment, PIA? That is very important as well. It's open until the 21st. So if you are unsure if you have filled it out or if you don't think you've received it, please contact me. And as well, for the PIA to be approved by New York City, if I'm collecting them right now and then I will analyze them, if I find that I need more information, I will definitely reach out and ask. Another thing to keep in mind, again, if you are credentialed with or at least have an LOI with an MCO, this is really, really important. This is the whole reason for our program. Also, lastly, have you completed the OMH readiness survey? I cannot say this enough. This survey is really important in order to participate in this program. As you receive other program materials, you're going to complete and return the HIT assessment and the PPA. Both of these will be in the welcome packet that we give. So once we get to that step with everyone, we can go over that further. And as well, the whole reason for this program, do you have at least one HCBS service that is active? If that is the case, then you are more than welcome to start this program with us. After that, the vendor services do begin. So this is Sharon and my information, along with a little blurb about each of us. If you need any information in regards to the PIA, my phone number and my email address is there, and I'm more than happy to answer any questions. I'm always available. No question is too silly for me. So I guess that would be it. I hope you all enjoyed this presentation, and I hope it was very helpful.
Yeah, just to let you know, there's some reference materials here for anyone who wants help with the acronyms. We have a glossary of terms, and there's also some workflows here for anyone who wants to delve in deeply as to how the system works and how the services are performed and where the technology is used. There's 2 of those, and there's this one that goes, it's actually, NYEC had put this together, and that was Boris, and that's the HCBS workflow as well, so that might be helpful information. So now I think we're ready to answer questions. Those questions I think were gathered. There's Boris or Eric who's going to be presenting those questions.
Yes. Thank you, Sharon and Erica. This is Patricia again. On behalf of NCTAC, we would like to thank Sharon and Erica and the New York eHealth Collaborative for putting together this wonderful and informative webinar to help out our community. Like Sharon said previously, we are now going to turn it over to our Q&A session. Just to be accountable of time, it is 11:43 a.m. For our attendees, if there are additional questions, please feel free to still type them in to your chat box on the right-hand side. And questions, I'm going to be reading out the questions, and then Boris and Eric Weiskopf from OMH will be answering. And Sharon. Okay, and so we are going to begin. I'm going to start with our questions. And so the first question asks, do agencies get milestone 2 and 3 payments if we already have an EHR?
That's a good question, and the answer is, number 1, is it an EHR that's a qualified EHR? So we're going to have a short list, maybe up until 20 vendors. Right now we have about 6 or 8 that look like they're qualified. So the first thing is to identify whether it's qualified, and we had criteria for that. So if you have an EHR and it is qualified, you qualify for the upgrade services. And yes, you will receive payment and assistance with that, because we want to make sure you understand how to use your system for HCBS. So yes, those using a qualified system are qualified to receive payments from this program and assistance.
Great.
Okay, great. Thank you for that answer. I'm going to move on to the next question. And the next question reads, when will there be a final list of approved vendors for billing available for the rest of state to make a selection?
So right now we're doing the testing of those systems. We've already tested, I believe, 4 systems that look like they are making that list. That list will be posted at the link that's in this presentation. And we have at least another 4 that are about to be tested, so we'll probably have 8 very soon. And those are great systems to select from, and soon we'll have even more on that list. They're coming in as we speak. They were due around now to have it upgraded, and now we're just doing demos and checking.
Eric or Boris, did you want to add to that?
Not on my end. I think, I think you answered it, but I don't know if Eric wanted to add anything.
Yeah, we plan to have a vendor fair during October, where we're going to have those qualified vendors showing off their systems, so you guys will get to understand what vendors are available and get to learn about them. The date has not yet been announced, but you'll be hearing about that shortly.
Thank you.
Great, thank you so much. So we're going to go to the next question, and the next question reads, how can we check to see if we have already completed the PIA?
That is a great question. This is Erica. I will answer that. If you are not sure if you completed it or not, I would encourage you to either call me at the number on the screen or email me, Erica Manganelli at NYEhealth.org. And I will definitely let you know if you or someone else in your organization has filled it out. I'm sure there are many people doing many things at your organization, and sometimes it gets lost in the shuffle, so I'm more than happy to let you know if it's been completed or not.
Great. Thank you for your response. We're going to move on to the next question. And the next question reads, are we eligible for HIT funding if we already have an approved EHR vendor/system?
So I think that was the first question we got as well. And yes, you are eligible as in the upgrade category. So the funding will be smaller than those that are getting full or partial services, but it will still be a significant payment, and it will be allowing your system to upgrade and accommodate the licenses for the HCBS provider and training on that system as well. So the answer is yes.
The reason just to clarify, the reason the funding is smaller is because it is, you do not need a full implementation of an EHR. You simply need an upgrade of HCBS functionalities. So it's not that it's because we want to just give you less, that's what is calculated into it. You don't need as much funding as the full.
Great. Thank you for your response. The next question is, that we have from our participants is, have the PPA agreements gone out yet?
That is a great question. The PPA agreements have not gone out yet. As Sharon and I both mentioned, the welcome packet that we will be giving to providers when we set up on-site assessments, that will include the PPA. So as soon as I am finished analyzing the PPAs, there are many of them, there are many of you, we will start setting up times to meet with everyone. And in that instance, that is when the PPAs will go out.
Great, thank you.
Great.
So there's a question from actually Case Management Agency, and I just wanted to address that and make sure Sharon, Erica, and Erica jump in please here as well. So again, just to be clear, this presentation and this program is for HCBS services, and I understand some case management agencies under Health Home are also, on an agency level, might be designated HCBS provider. And I also know under certain circumstances, depending on the Health Home, there's already an electronic health system that the CMA has to use as part of that Health Home. Again, just so there's a question about how, is that related? Are they going to be the same vendor? Is this going to be addressed? So I just wanted to make sure that folks are clear. This is about HCBS and HCBS use. If the case management agency has to use a particular EHR vendor for their Health Home, that is separate and apart from this discussion. If it happens that the same vendor, that's both the Health Home vendor ends up being on the approved list for the HCBS, I think that's great, and probably will be less of an issue for the provider because they'll be on one system, but that at the end still needs to get resolved. So I don't know if Sharon, Eric, or Erica wants to jump in here, and I just want to make sure folks were clear on what this is about.
Right. Well, that sort of touches on the interoperability piece we're talking about, and the goal is to have exchange of data among all of the partners, including Health Homes and RIOs. So that's the goal later on. Right now, we're identifying HCBS systems, and again, as you said, Boris, if a HCBS system that's qualified also is something in use by the Health Homes, then that's the best possible solution. So we'll see as we move on which of those systems they are.
Great. Thank you for your response. Are there any other responses from our presenters?
Nope, I think we're good.
Okay, great. So I'm just going to move on to the next question. And the next question from our participants, it asks, is it possible to request a full implementation if the cost to upgrade of our EHR is more than the cost to purchase a new system of better quality?
So the answer to that is that if you have a system that's on the qualified list, we are not planning to replace that. We're going, since it's already, it's satisfied the criteria of what we felt was a qualified system, and we will upgrade that system and not replace it. Eric, would you agree with that answer?
Yeah, that's generally the answer that we're going with. If there's a particular case-by-case issue that is extenuating, we would be open to listening to it. But generally speaking, if you have a system that is not on the qualified list, there is as Sharon said earlier, there's a capped fee that you will be, paid. And if the new system costs more than the capped fee, then you would have to come up with the difference. Most of the systems that are on the qualified list are actually less expensive than the amount of money that we're providing you. So you should be able to, generally, pay for the whole setup. There are a few more expensive products that if you choose to go that route, you would have to come up with the difference. But if you have a qualified vendor already and you get the upgrade, there would be no cost to you for the upgrade. If you needed to change your system, that would be on you. That would not be part of the BHIT program.
I also want to add the reason, so this program is 2 years, and we are here to help you find the best solution. So if you do need full implementation, we are going to help you find the best solution that in 2 years you'll be able to pay without needing assistance necessarily. So we're not going to ask you to get a really expensive or guide you to get a really expensive EHR if financially your organization does not have the means to pay for that in 2 years. So we will not steer you wrong in that sense.
That would be sustainability. We're looking for you to stand on your own feet after the 2 years of licenses that we are financing, assisting you with.
Okay. All right, great, thank you. The other we got a couple of questions in general about how can EHR vendors still get on the list and be part of the process and eventually become approved vendor as well. I believe the answer is yes, and providers should talk to if they currently have a EHR vendor. It's not on any of these lists, and they would be contacting who if they wanted to encourage their vendor to be part of this process?
Yeah, we can assist them with taking a look at those vendors that are not on the list that satisfy the criteria. Remember, we talked about the criteria. They need to be certified on the CHAPL list of the ONC, which is a list that was put out by the federal government for meaningful use purposes, and that's our baseline for establishing their passing the requirements for this program, and there were other requirements too. So if they satisfy those requirements, we would welcome them. If we tested their program and saw they do it as we need for this program, then that would be great, and they could theoretically be part of the pre-qualified list and then hopefully achieve the qualification. But we have time frames, so things need to move pretty quickly for that to happen. So if anyone has a vendor like that they'd like to see on this list, please reach out to us as soon as you can.
Okay, great.
Great. So we're going to go on to our next question, and the question reads: If we have already expended funds from EHR billing from a certified vendor, are we eligible for retroactive reimbursement under this program?
The answer to that is only if they contracted with that vendor from June 1st, because that's when this program started. Any contracting that took place from June 1st, 2016 forward, that contracting can be paid for using these funds.
Excellent.
Great question. Okay, great answer. Next question reads: For those of us who have submitted our completed PIA, when should we expect a call to set up the meet and greet?
That is a great question. The PIAs are all due back by the 21st, so I am hoping that you can expect a call the first week of October. I am actually going to be out of the office for a week in the middle of October, so if you hear radio silence for a minute, it will only be because I'm out of the office. However, Sharon will be around, and she will be able to answer any of your questions. And if you you want to book a meet and greet.
Yeah, I expect that we'll do those meet and greets sometime late October to November, till we get all the materials together, everything set up. Then we'll start doing that. We're going to have a tour in the rest of the state. And like we said, but the vendor fairs you should definitely participate in, and we're going to let you know about them. There's going to be 3 of them, one in New York City. After that, there'll be one in Albany, and after that, there'll be one in Rochester. Those are the 3 locations that we're expecting to have them in, and we will publicize them as soon as we get our sites pinned down and the dates, which we expect them to be in October.
Yeah, this is Eric. Let me just accentuate that by saying that as NYEC gets in the paperwork and they're able to start putting the different provider agencies in their status of full implementation or partial or upgrade, the priority as far as the order of the meet and greets and trying to get everyone the full implementation first, because those are the folks that are in immediate need of trying to get some sort of an electronic system, followed closely by the partial. Does not mean we do not place a great deal of importance on those folks who need an upgrade. So they have product already and needs to get in. So NYEC will certainly be out to see you. But if you happen to be in the upgrade category and you don't hear from them quite as soon, just be patient. They will get to you. But we will be sort of prioritizing in that order of getting those folks on board.
Okay, wonderful. And we have time for just one last question. And so the last question reads, do the BHIT payments for technology upgrades go directly to the vendor?
No, the payments go to you, the organizations, the provider organizations. What happens is that you will work with the vendor. You'll decide which vendor you're going to select based on our working with you to help you with that decision. And then once you have that contract signed showing that you are using this and this vendor, then we will release funding to you, and you will pay from that funding.
And it's important to know that the vendors will not get paid until New York eHealth Collaborative, until us, we get paid from the state. So after we get paid from the state, then we will send money to you. We will cut you a check, and then from there, you can pay the vendor.
Right, so that's it. So you're paying the vendor. The contract is between you and the vendor, and we will support you by providing funding assistance, which should take care of the complete requirements for a new, partial, and upgrade system.
And with that, also just note, this is not a reimbursement grant. This money is, as a provider organization, you act as the flow-through.
And again, there are certain vendors that will be more costly than the money that you'll have available. You can still select them, but you'll have to supplement what we provide you with your own funds if that's your selection.
Great.
Great. Well, thank you once again. I would like to thank once again our presenters for today, all those that participated and sent in their questions, as well as those here from MCTAC and from OMH that took the time to also assist with the responses. So this is the end of our webinar. As was mentioned earlier, if you have questions, if you have a question that was not answered, or if you have additional questions, please feel free to reach out to Sharon and Erica. And once again, as it was mentioned at the beginning of the webinar, is all the questions from today are going to be collated and answered, and then they will be made available to all the participants at a later date and time. So on behalf of NCTAC and the New York eHealth Collaborative, we thank you again for attending this webinar. And please feel free to reach out if you have questions, and look out for the slides and recording, which will be posted in the next couple of days. Thank you, and have a great rest of the day.
Thank you.
Thank you very much.